Good morning, ladies and gentlemen. My name is Tarek Al-Tawil, and I'm one of the orthopedic surgeons at the National Institute of Neuromotor System in Cairo. I'm presenting a case of bilateral total knee replacement with 22 years follow-up with excellent result. This X-ray dates back to 1994 when the patient started complaining. And actually, I saw her in 2001, and by the time she was thinking to listen to our advice and have a knee replacement. I apologize for the quality of the X-ray as it was kept by the patient herself. So we actually started with the right one, but the immediate post-op X-ray is not available, and we have many other X-rays in the long-term follow-up. So this is the post-op for the left knee, and as you can see, there is a very nice fit of both femoral and tibial components and good tibial slope as well. And you may notice here that the tibial component or tibial tray is very slightly lateralized. This is in her 4th year for both knees, and actually she was doing quite well and no radiological changes, whether on the AP or on the lateral views. And this is the lady in the 4th year. She can do full extension of the left knee. Flexion is more beyond 120, and full extension of the right knee, but flexion is limited to about 80 degrees. She takes off easily from the chair, and she can walk without aid, as you may see here. Back to chair, and that's the follow-up of the 6th year, and the lateral views. See everything in place. And this is the 7th year, and the lady on the 7th year is walking quite well, and she can flex the left knee to more than 120 or 30, full extension, and flexion to about 80 degrees. This is now the 12th year of follow-up, and as you can see from the X-ray, everything is in place. And these are the lateral views. And this is the lady in her 12th year, standing quite happy, satisfied with the result, with perfect alignment, flexion of the left and flexion of the right still limited to the same 80 degrees. And this is the 13th year, and the lateral views. 17th year, no change, everything is placed. And you may notice that actually we did not use, if any, cement for the tibial stem, whether on the left or on the right. I did some measurements, as you can see, on the lateral views, and on the left side you can see that the tibial slope is acceptable actually, while on the right side the tibial slope is actually reversed, and this may be a main cause of limited flexion of this lady. And this is a magnified view to show you the perfect alignment of the tibial component, and actually there is no cement around the tibial stem, and also no cement around the stem on the right side. And now this is 22 years with a rather active lady who can get outdoors and walk and travel to Saudi Arabia to do Umrah. She did this 5 times following her operations. And this is the AP, and as you can see, no signs of loosening or both components, whether femoral or tibial, and the thickness of the tibial insert, I believe, did not change over the years. And you can notice this nicely, the tibial plastic insert, actually no affection of its height, and very stable, whether femoral or tibial component. And this is the lady after 22 years standing with a perfect alignment, almost full extension, active extension of her knee, whether left or right, and satisfactory range of flexion, very good on the left side, up to 80, but actually, if you look at her, she is still doing quite well, despite all these years. So we conclude from this long-term follow-up that slight lateralization of the tibial component may not be symptomatic, and it did not affect stability of the component. Not using cement for the tibial component stem did not affect its stability on the long run. Reversing the posterior slope of the tibial component can limit flexion of the knee, but it did not affect the stability of the component and did not lead to early polyethylene wear. Thank you for watching, and I hope to meet you in another presentation.